Good afternoon and welcome to our final session of the 2020 Striking a Balance Caregiver Conference. My name is Rob Fabian with Age of Central Texas, and in addition to our wonderful partners over the Area Agency on Aging of the Capital Area, we are so glad that you're joining us today for this session. This is our very first year that we have presented a virtual presentation of the 19 years that we have been doing the Striking a Balance Caregiver Conference. And it has been a learning experience as we've gone. So if we have any little technical issues on this last session, please forgive us. But we are so glad that you're here because we've got some great information that we're going to share with you today about what you do if you have a loved one who's in a long-term care facility currently, and how you can work with that community to ensure the best care for your loved one. Before we get started today, we've got a couple of videos that we want to share with you. First of all, our executive directors from Age of Central Texas and the Area Agency on Aging would like to welcome you to the conference. And then we have some great information from our partners over at AARP Texas, who are our presenting sponsors for this year.
Hello, everybody. Welcome to the 19th Annual Striking a Balance Caregiver Conference, brought to you by the Area Agency on Aging of the Capital Area and Age of Central Texas. We are so happy to have you join us at our first ever virtual conference. We were talking about doing this, and we had a little bit of fear and trepidation, and then we thought, well, all of the caregivers that I know exude resiliency, they exude strength, they always have the ability to turn on a dime. So we thought, well, you know what? We better honor them and we better do the same thing and host this conference virtually so that we would have the opportunity to engage with y'all again. Some of you might know that we had a lot of repeat caregivers attending our conference every year. We didn't want to let them down, but we also did not want to miss out on bringing in new caregivers. And virtually, we have the opportunity to do that even more. So we are so excited to have you join us in a number of sessions that will address some of the issues that you might encounter during your caregiver journey. I'm going to turn it over to Suzanne.
Hi, all. My name is Suzanne Anderson. I'm the Executive Director of Age of Central Texas. And like Patty, I am so glad you've chosen to participate in the 19th Annual Striking a Balance Conference. And what I love, in addition to what Patty just shared, is that if you chose, you could be sitting here in your PJs if you're so inclined. So, a special thank you to the Area Agency on Aging. Patty Bordy and her staff have been exceptional. In addition, a special thank you to Rob Fabian of Age of Central Texas, whose leadership and technology skills have really allowed us to offer it in this format. I want to just share a quote. It's one of my favorites that I apply to my life, depending on where I sit within different challenges. And believe it or not, it's from Lena Horne. And what she said is that it's not the load that breaks you down, it's the way you carry it. So, we know caregiving is full of, swirling things like joy and love and stress. And I could go on and on that one, but we hope through the conference you find new strategies to help you carry that proverbial load, and that you feel supported by AGE and the AAA, and that know that we're here for you. So thanks so much for joining us in the conference, and we look forward to hearing your feedback. Take care.
Hello, I'm Jessica Lemon of AARP Texas, and I am pleased that AARP is a proud sponsor of the Striking a Balance Caregiver Conference. As a sponsor, we hope that you are gaining new insights into family caregiving and that you have the opportunity to connect with other caregivers and experts on aging. Family caregiving is a priority for AARP. It's essential to our work today, but that's not all. AARP is doing amazing things to make life better for the age 50+ population and generations that follow. We help people improve their financial well-being and their health. We want people to contribute to society and local communities and to fully enjoy life. Let's take a moment to discover more about what we're up to at AARP.
Our story begins more than 60 years ago inside an abandoned chicken coop where our founder discovered a retired teacher living, no home, no health care. So she said no to this injustice and yes to transforming lives. It's this drive, this compassion that inspired AARP. Today, we empower people to choose how they live as they age. We advocate for health and financial security. We strengthen communities everywhere. We are AARP, creating real possibilities.
I want you to know that AARP has a strong presence throughout Texas in many communities in this great state, including Austin, the capital city where I live and work. This year, AARP Texas is bringing opportunities to our members and others through virtual events like this one we're participating in today, and on platforms like Facebook Live. We hope you have the opportunity to enjoy these free offerings. Not only are there programs to help unpaid family caregivers, but there are presentations to help people avoid being the victims of fraud. We host fitness seminars, and we work with city leaders towards making this an even more age-friendly community. And know this, volunteers are critical to our mission. There are many opportunities for those who can give a little time to volunteer. You can learn more about these local happenings at aarp.org/TX or catch us at the AARP Texas Facebook page. Again, of course, family caregiving is a priority. Here in Texas and across the country, AARP is working with governors, state legislators, and community partners to take common sense steps to support America's 40 million family caregivers. We know that caregivers help their older parents, spouses, and loved ones live independently at home. And right now, AARP is fighting to protect nursing home residents against sickness, neglect, and isolation during the COVID-19 pandemic, while also educating family caregivers on how to advocate for their loved ones. Sadly, more than 62,000 nursing home residents and staff at those facilities have died from COVID-19, and the death toll continues to mount. These are mothers, fathers, grandparents, and spouses with families who love them. Nobody should be going through what nursing home residents and their families are experiencing today. Families want elected leaders to take action now to protect residents of nursing homes and other long-term care facilities. Right now, no state is doing a good enough job to protect these residents and staff. Congress must take immediate action to provide regular testing and personal protective equipment for residents and staff. There should also be timely and reliable reporting of COVID-19 cases and deaths. There also must be virtual visitation allowed for families. And finally, we urge lawmakers not to let nursing homes off the hook for abuse, neglect, and even death. Now is not the time to strip away the rights of nursing home residents. AARP will continue to fight for family caregivers and other families. We appreciate your support and for listening. We have many resources available for family caregivers just like you. One place to go for information is aarp.org/caregiving. Thank you for listening, and thank you for all that you do as family caregivers or to support caregivers.
Thank you so much, Patty and Suzanne. Thank you, Jessica, for that information. And thank you for joining us today. We are very glad that you're going to be a part of this last session for the 19th Annual Striking a Balance Caregiver Conference. Before we get started with our session, we've got some very brief housekeeping to go over. Number one is that these sessions are all being recorded. So if for some reason you get knocked out of the session or you need to leave before we're done, don't worry. We are recording them and we're going to post them on YouTube. We're going to send you a link to all of the sessions along with all of the handouts and all the materials from the entire week. We're probably going to send that to you tomorrow, and so keep an eye out for that. Also, when you received your email reminder for this session, you also had 3 links that were included in there. There's some great information there that I want to remind you about. Number one is the program for the entire conference. Not only can you find the bios for all of our speakers, but also some great information about resources that are available. Number 2 is that we also sent you all the handouts for these sessions. So those are available there as well. And then finally, we sent you some great caregiver resources. Both Age of Central Texas and the Area Agency on Aging combined our services of lots of great resources, handouts, and materials of all of the programs that are available throughout the community. So take a look at that because that can help you in your caregiving journey. And remember, this is why we're doing these seminars for you. Why we have done this for 19 years is to bring you the best information that we possibly can to help you in your caregiving journey. Finally, we have a chat feature that we want you to utilize today. If you look right down here on your screen, you have a chat button. It looks kind of like one of those thought bubbles that you see in the comic strips. Click on that and it's going to bring up the chat feature on the side. And we want you to ask your questions today, because at the end of the session, we're going to have a facilitated Q&A, and we are going to answer your questions. Now, we do have a little bit of limited time today because we are live, so we might not get to every single question. So far on all 7 of our previous ones, we've been able to answer all of them. If for some reason we don't get to every single question, do not worry. We're going to answer your question, because someone from either Age of Central Texas or the Area Agency on Aging is going to contact you personally and give you the answer to your question. But we want you to ask your questions today, because that's why we're here, to provide you the information. And if something is not explained completely, or you have a question specifically about long-term care communities or how you can best be of service to your loved one, be sure and ask those questions, because that's why we're here today, is to make sure you have all the information, all the answers that you need. One final thing, if you look in your chat box right now, you will see a note that lists Michelle Davis and her information. If for any reason you're having technical difficulties today, if something is not working right with your device and you're not seeing or hearing everything, give her a call, because we have some volunteers who retired from the tech field here locally who are standing by today. So if you're having issues with your device or having trouble with Zoom, they're going to be able to help talk you through whatever is not working on your end. So it is my pleasure to now introduce Jessica Martone from the Area Agency on Aging. She's going to be our facilitator today, and she's going to introduce our speakers. So Jessica, take it away.
Thanks, Rob. Well, y'all, I have a special treat today because I get to introduce to you 2 of my most favorite coworkers from the Area Agency on Aging. First, we have with us today Pete Moreno. Pete is the managing local ombudsman for the 10-county region of the capital area. He's a certified long-term care ombudsman, and he has over 12 years experience protecting the health, safety, welfare, and the rights of consumers in Central Texas. Pete's employed by the Area Agency on Aging of the capital area, and his experience presenting residents' rights and other long-term care topics to large groups includes providers, residents, family groups, and community organizations. Along with Pete presenting today is Ms. Darla Bower. She is also a certified staff ombudsman for the long-term care serving the capital area. In both her professional and her personal life, Darla has served as a caregiver and an advocate for persons of all ages and abilities. After completing her education at the University of North Texas, Darla started as a volunteer ombudsman with the Area Agency on Aging. So thank you 2 for joining us today. Pete, go ahead and take it away.
Good afternoon, everyone. First of all, I want to just thank everyone for the opportunity to speak today. I want to introduce myself. My name is Pete Moreno. I'm the managing local ombudsman.
Pete, I'm sorry. I need you to switch your screen.
Again, okay.
Thanks, Pete. Perfect.
Okay, hold on a second. Anyway, we're Region 5. We have a 10-county. We cover a 10-county area. We have 76 nursing homes that we visit, and we have 172 assisted livings that we visit. Our staff consists of myself, the managing local ombudsman, and we currently have 5 on staff, 2 full-time and 3 part-time. And it's a big job. All the staff does a great job. They visit the nursing homes. They take care of the residents. They watch out for everyone. Each and every one of them has a special talent when they came into the program, and they use those talents out in the field, and they do an excellent job protecting residents. And in long term, that's our main goal, is to protect residents' rights and to make sure that residents have a great quality of life living in the facility that they're at. And that's what we're there for. We're there to help them achieve those goals. And I really appreciate the hard work that they do, more than everyone really realizes. I'd like to also let you know, as caregivers, I know how hard and important a job that is. And I really appreciate the opportunity to present the long-term care ombudsman program to you. And it's an honor for me, it really is. And I know that our staff is happy that we're doing this. If you ever are out in a facility and have a chance to see us, or we're out in somewhere at a meeting or somewhere, a lot of times you'll see us, we'll be wearing a blue ombudsman lanyard, and you can just, it'll say ombudsman, and that's how you know you're actually speaking to a certified ombudsman that's in your area. So with saying that, I'm gonna go ahead and go to our presentation. The first thing I want to do is talk to you about the objectives. During this presentation, I want you to understand the role of the long-term care ombudsman. I want to characterize the types of concerns where ombudsman involvement is appropriate. I want you to understand ombudsman consent and confidentiality requirements. Identify advocacy tools that enhance resident empowerment. Long-term care, the long-term care ombudsman program. The long-term care ombudsman advocate for the rights of people who live in nursing homes and assisted living facilities, so they receive optimal quality of care and achieve high quality of life. It is a federally mandated program established by the Older Americans Act. I want you to remember, ombudsmen don't work for the nursing homes or the assisted living facilities, and all our services are free, confidential, and available statewide. We're advocates for residents of nursing homes and assisted living facilities. And we really want you to know that confidentiality is very important, and it's important that you understand whatever is said between an ombudsman and a resident is confidential, and we're not allowed to say anything unless we actually have consent from the resident or the legally authorized representative. Our Region 5 structure, we operate under the state office, which includes state long-term care ombudsman and the staff who work directly under the state long-term care ombudsman. The state long-term care ombudsman certifies each volunteer, staff, and managing local ombudsman. The state office trains and supports our local programs. The state office sets policies and the program systems advocacy agenda. There's currently 28 regional ombudsman entities throughout Texas. Texas has about 500 volunteers in the area. We have the larger programs actually have staff such as Capital Area. We have our staff ombudsman that will specialize. Some specialize in nursing homes and some specialize in assisted living. Our basic volunteer training is the same for staff as it is for all the regional ombudsmen in the area. Long-term care ombudsmen are resident advocates. Means we help families understand how to choose and pay for nursing home and assisted living facilities. We explain residents' rights and how things should work in a long-term care setting, provide advice on how to solve problems in long-term care settings, provide in-service training opportunities for facility staff on topics such as residents' rights and person-centered care. We provide presentations to associations and organizations interested in more information about our program. We help residents and their families develop resident family councils and provide information, and so can sometimes help residents relocate to less restrictive settings. A lot of times we will help with money follows person. Ombudsman investigate work to resolve complaints on behalf of residents. They provide an informal complaint resolution process. We identify and investigate complaints that adversely impact residents. We conduct investigations using observation, interview, and record review. We work to resolve problems on behalf of a resident, and we serve as a resource to families and facility staff in resolving disputes related to care practices and priorities. Ombudsman may represent residents in meetings to resolve complaints, care plans or service plan meetings, fair hearings related to Medicaid-funded services, or nursing home discharges, and systems advocacy, such as making recommendations to federal, state, local, and governmental agencies. When can an ombudsman help? An example, we protect residents' rights, quality of care, quality of life, problem issues, family issues, problem solving, discharge questions, staff in services, speaker for resident or family council. An example would be Mrs. Smith gets help taking a shower in the morning, but she would rather take her shower in the evening. An ombudsman may help to resolve that issue by persuading or negotiating with the facility staff, filing a complaint on behalf of the resident, working with a resident council, getting a group of residents with similar concerns together to solve the problem, or bring the matter to the attention of outside systems such as Medicaid or regulatory services. Sometimes what an ombudsman might want to do is speak on behalf of the resident, and the resident might want that as well. If a resident is unable to communicate their wishes and has no one else to call upon for help, the ombudsman can get involved. We help with family conflicts, we help a resident not be afraid to speak up, and we work to solve resident problems. Going back to Mrs. Smith, if Mrs. Smith wants her shower, and she can contact the ombudsman and explain to her, and the ombudsman can explain to her that the facility has scheduled a shower in the morning. She prefers to shower in the evening, and at the direction of the resident, the ombudsman would speak to the facility staff about adjusting their shower time. The facility explains that they're in the process of hiring a new caregiver for the evenings. And once that caregiver starts, in the next week, then the change will be made. The ombudsman makes notes to offer to attend the resident's next care plan meeting and request that her bathing schedule formally discussed and documented at that time to ensure the facility maintains the agreement. Consent and confidentiality. The Older Americans Act requires protection of the identity of residents and complainants and information obtained about residents and complainants. During the course of ombudsman duties to maintain confidentiality, the ombudsman must not take action on behalf of a resident without the resident's consent, including accessing records, not identify residents or complainants without their consent, not disclose confidential information about resident or complainant, and explain our confidentiality requirements to facility staff and other agencies who may expect that case information can be shared. If a resident is unable to consent, there are special guidelines ombudsman must follow, and that would be to contact the legally authorized representative if possible before we would be able to identify the resident to the facility. What we look for when a complaint is identified. Ombudsmen regularly visit all long-term care facilities to build relationships with residents and address any complaints. During a facility visit, ombudsmen consider the following questions for any possible problems in the facility. We listen to the resident and take the resident's perspective. We investigate, observe, interview, and review records. We advocate even if there is no regulatory violation, and we determine if other people can help. And we will only take action with permission from the resident or complainant. And then what we look for is, are the residents clean and dressed? Are they participating in regular activities? Are they receiving meals and snacks? We ask about individual preferences. We make sure that they're being heard. Are they being treated with kindness and respect? And do the staff know the residents by name? Do the staff respond quickly to call lights? Knock on doors before entering a resident's room? Treat residents with respect, courtesy, and dignity. Ensure residents are covered for privacy when being moved in the hallway for a bath and while improving care, and wear name badges. When a complaint is identified, we listen to the resident's perspective again, and we only take action with permission. The frequent top complaints in a nursing home: failure to respond to requests for help, the food service, cleanliness, pests, housekeeping, dignity, respect, staff issues, symptoms unattended, healthcare, including no notice to others on change of condition. In the assisted livings, food service, equipment and building in disrepair, cleanliness, pests, housekeeping, medications, and odors. Resident advocacy tools. We help resident concerned to resolve his or her own problems. We encourage participation in resident council, educate about residents' rights, educate about facility grievance process, encourage participation in care or service plans. A care plan is a document that guides the delivery of care for each resident. The care plan addresses quality of care and quality of life issues in a way that supports residents' rights. Thank you for listening to me. I kind of just wanted to go through that. I wanted you to get an idea of what we do when we are in the nursing home or in the assisted living. Our main goal when we're in these facilities is to protect residents' rights and to protect resident dignity and help them to have the best possible quality of life in these facilities. And with that, that ends my presentation, and we're going to move over to Darla.
Hi, everybody. Can you hear me okay? All right. My name is Darla Bower. I'm a certified staff ombudsman with the Area Agency on Aging of the Capital Area. Thank you for that wonderful introduction, Jessica. I'm going to be presenting on some of the handouts that were sent to you earlier, hopefully. So I'm just going to highlight a couple of points from each, and then we'll take questions at the end of the session. So waiting for that PDF to come up. Thank you, Pete, for doing that for me.
Do you see it, Darla?
No, I don't. We're still on your presentation. Bear with us for a few seconds. Okay, great. So the first topic I'm going to cover is finding a nursing home. Choosing a nursing home or skilled nursing facility is what we'll refer to them as well, is a very important decision for you and your loved one. There may be other long-term care services and supports that fit your needs, such as receiving care in your home. But if you decide that a nursing home is the right choice, there are some resources to help you find a facility that best meets the needs of your loved one. To locate a facility and explore options, first and foremost, I'm going to suggest the Local Ombudsman Program. Since the Local Ombudsman Program covers the nursing facilities in this region, we're going to have a lot of information about it. There's also another resource listed is the state long-term care program, and it lists an 800 number. So you can refer to that also. There's also find a long-term care ombudsman in your area included in that feature, and there's also a contact for that where it will direct you to the proper ombudsman that serves the particular region or facility. Okay, can you go back up one more page, Pete? Okay, so couple of questions. Ask about the facility and resident policies when you're looking. Use your ombudsman as a resource also. Go visit the facility once you're able to visit the facility. Visit with other staff members. Go at off times, such as meal times or on the weekend, to see how things are going within the facility. Follow any reviews that are posted or listed of or about the facility, but I think your best resource is going to be contacting the local ombudsman program. Now, there are other things that are covered in this PDF handout, so be sure to read this as a resource. Make sure you're asking questions about the policies of the facility and resident policies, staffing, training, visit with staff, talk to your friends and neighbors and see if they have any experience with the facilities in your area. Ask about how needs can be met for your particular loved one and any special needs that they may have or important routines. All of this needs to be addressed, and make sure you have a very clear understanding of what services are covered by Medicaid, Medicare in your facility. Okay, go to the next screen, please. Now, some of the same points apply when finding an assisted living facility. It's also an important decision. Some of the same resources are listed. Go back for unannounced times and visits, including meal times, evenings, and weekends. Talk to current residents when you're able to actually physically visit the facility. And two important points for both nursing homes and assisted livings: always request a copy of the inspection report for every facility. It's available to be viewed, and pay attention to that survey and what's in that survey, because any deficiencies can be identified in that survey. Now, one of the things I really want to touch on with an assisted living is exploring the assisted living facility services and costs, okay? Because Medicare does not cover assisted living facilities, and only a handful, I think I can only think of two right off the top of my head, will accept Medicaid. So when you're exploring your options, be sure to ask for the costs of the care up front, the services and costs, and please read that contract before you sign on the dotted line, because the contract will explain exactly what services are covered or not, the cost of care, the different levels of care, and if any specialty care can be provided. So find out what payer sources does the facility accept. Is this facility only accepting private pay, or does it accept long-term care insurance? And remember that Medicare does not pay for assisted livings. So what happens if the money runs out while living in an assisted living facility? Does your facility participate in Medicaid? Will the facility allow Medicaid funds to be applied toward the cost? So there are benefits counselors available at the Area Agency on Aging. And remember, your local Area Agency on Aging can be a resource of information to help guide you through this process. Okay, make sure, I'm not a Medicaid expert, but make sure you know some things about Medicaid and how to apply for the benefits, especially if your loved one is going to need a payer source through Medicaid. So we have benefits counselors that can help with that. So remember that your Area Agency on Aging is a great resource of information and guiding you through the process. Okay, next screen, please. Oh, I want to point out too, you can also call 211. Your Texas benefits will tell you about what's available in regards to Medicaid. Okay, so long-term care services in your area through 211, you choose option 2 for help. And also remember that your local Area Agency on Aging is a great resource. Okay, I want to briefly touch on Medicaid and stimulus checks. Medicaid eligible residents of nursing or assisted living facilities, their family members, the resident is eligible to receive this stimulus. Okay, so now there's a couple of important points that I want to make here. It has to be spent within 12 months. If there are unspent funds at the end of that 12 months, it's going to be counted as a resource. And Medicaid is automatically extended for all current Medicaid eligible individuals. Anyone who currently has benefits will not be denied during this period. But however, Medicaid spending rules still apply, as these funds will be calculated in a look-back period. Be sure to keep all receipts of expenses, especially for purchases over $200. Okay, now the biggest question that we receive of all, will the stimulus check count as applied income? The answer is no. As a tax rebate, the individual stimulus check will not be calculated as applied income in a nursing facility or co-payment or room and board in an assisted living facility. A person's applied income or co-payment amount will not be changed by the stimulus check. Next page, thank you. How does a resident decide to spend the money? A resident, remember, has a right to manage his or her own money as they choose. If a resident chooses someone to manage their income, that person has a responsibility to spend the money on the resident's basic needs, and that does include healthcare and clothing before spending on other things the resident wants, okay? Now, if the facility or facility staff member is acting as a representative payee for a resident, the representative payee manages only a resident's Social Security or supplemental security income, so SS or SSI. The stimulus check is not Social Security or SSI. And now there's a list of examples of allowable spending on Medicaid approved items. So remember, the rule is that stimulus amount must be spent in 12 months or it will be counted in the resource limit. Okay, Pete, is there anything you would like to add to that one?
Keep receipts, because you might be asked.
Okay. All right. I'm moving right along. Okay, now during this pandemic, it's been a very tricky situation because caregivers, family members have not been able to visit their loved ones in person. So we understand the anxiety that that can cause. What are some ways you can stay connected? Some facilities have gotten very resourceful about how to provide some options. There's the traditional mail-in letters, cards. We have some facilities that are scheduling video calls and messages such as FaceTime on iPads, and it's still in a private setting, so the resident has the right to visit privately. So facilities are scheduling those visits. Phone calls, if your loved one is able to speak on the phone, schedule a time to talk with your loved one. Distance visiting, you may be able to visit through an outside glass window or door, but however, remember that the visiting, we are being phased in. So I don't want to comment on where we're at on that until we go through the questions at the end. Okay, next page, please. Next page, thank you.
Okay, hold on.
Okay. Go to the next page, please.
I'm there. Are you not there? Do you not see what
No, I'm only seeing the first page. Sorry.
what are you seeing now?
Okay, the ways to stay connected, which we covered. And I can see the first page of the COVID response for nursing facilities.
Okay, that's where we're at, right?
Yes, correct.
Okay.
Can we go to the actual first page of it? There we go. Okay, there's a lot in this. It's actually a booklet. So I think we went too far. Okay, so the purpose of this document is to provide nursing facilities with response guidance in the event of a positive COVID-19 case associated with the facility. Next page, please. The goals of it are to rapidly identify a COVID-19 situation in a nursing facility, because we are aware they are our most vulnerable population, to prevent the spread within the facility. There's protection to be provided for residents, staff, and visitors, and provision of care for infected residents, and recovery from an in-house nursing facility COVID-19 event. So I'm not going to be able to go through every single page on this because this is a long booklet, but however, we want you to know that there is a COVID response plan in place for nursing facilities and assisted living facilities. Okay, go through a couple more pages and see if there's anything I need to cover. Okay, now there's also been guidance given to the nursing facilities where your loved ones may be. There's specific HHS long-term care regulation activities with nursing facilities that have positive COVID-19 cases. PPE needs to be provided. There's screening protocols in place. Essential workers are identified. They're to communicate with their local health authorities, determine the number of residents probable or positive for COVID-19, and the number of staff probable or positive. Isolation precautions must be put in place, and that the nursing facility staff must work with the local health authorities. So this kind of gets into the facilities activities required for long-term care COVID-19 response. Will residents that are positive for COVID-19 be placed in the same room together? That kind of thing. So it kind of goes through a step-by-step plan. I think the information is important and relevant, but due to the time factor, I'm not going to be able to cover everything in this booklet. So please be sure, if your loved one is in a skilled nursing facility, to go through this information. Okay, and you know, there's a plan. So there's a plan in place, and we expect the facilities to follow the plan. Okay, so here are some resources. Make sure you check through the booklet for all of the resources. There's state, regional, and local support. There's a rapid response team. There's a strike force that can be deployed to help facilities manage the COVID positive residents. And remember, all of these handouts will be emailed following this presentation. So there's an immediate response guideline. So I don't want to go through it page by page, but just know that the state is aware, and we all have the understanding that our loved ones are the most vulnerable population. And there is a reporting requirement that nursing facilities are required to follow. So this one is very interesting read, and it's information that is good to know.
Darla, you might want to let them know the requirements and information change all the time. This is,
yes,
what they're looking at is the latest guideline.
Yes, so
we have. So
Pete is pointing out that it's changed. The regulations and guidelines are changing sometimes on a daily basis. So we're up to date as much as we can be. Okay. So this booklet is a great source of information and kind of goes through it step by step, the plan. Okay, let's go on to the nursing, the next one. Anything else you want me to cover on that, Pete?
No, that's good. Just remember that the information does change, and all this information is public information, so it's all going to be available out there, and everyone should be looking for it. You can get it off of the HHS website.
Okay. Yes, you can. All right, next portion.
Hold on.
Thank you for doing that for me, Pete. It's so helpful. The COVID-19 response for assisted living facilities. So again, it's a booklet. It's going to go through it step by step. It outlines the executive orders. It outlines screening requirements, infection control, PPE, isolation requirements, testing, anything that I need to cover on assisted living facilities that may be different on skilled nursing facilities, Pete.
Well, let me see. No, not that I can think of.
Okay. So
It is different. There's not there's not as many cases in the assisted livings as there are in
skilled
the
nursing.
nursing facilities. So
That's true.
and so the regulations are a little different.
Yes. So we all know that visitors have been restricted at this time. So in both skilled nursing facilities and assisted living facilities. Okay,
That is changing. Darla,
yes, it is.
HHS is making planning on allowing visits now, but there's a lot of requirements by the facilities, nursing homes, and assisted livings. They have to have a plan in place and present it to the state, before they can start allow visits. And the facilities voluntarily have to turn in those plans, and once they do that, then they can begin visits. And so right now, a lot of facilities have started. Some have not started. Some aren't ready for it. So it's going to be a waiting period before I think everyone's ready to do that. But so if you're in contact with one facility, even though there's orders in place that it's okay, they may not be prepared. So you may not be able to go in right away.
That's correct. That's a good point. Yes. So remember, that's why I mentioned the phased in visitation. So that's what I was referring to, what Pete just said. Okay, let's go to the next PDF. Okay, frequently asked questions. Was that part of the other?
Hold on, my computer's.
Okay. Technology, yay!
Yeah, technology.
Okay, so frequently asked questions. There's a few things on here that we want to highlight. Remember, Governor Abbott declared a state of disaster for all counties in Texas due to COVID-19 pandemic. And he directed state agencies to restrict visitation at nursing facilities, our most vulnerable population. In addition, the Centers for Medicare and Medicaid Services, or CMS, directed all nursing facilities to restrict visitation and allow access only to staff or other individuals providing critical services. In other words, we refer to that as essential services. Okay. Again, this is updated and it's being changed constantly, so we're keeping up with it as quickly and as best as we can. Okay, guidance
This is the most up to date that I have.
Okay, great. I want to highlight, when is visiting going to be allowed again? The answer is we are actively working with our partners to issue a reopening plan to allow personal visitors. So just different scenarios. There's great resources on this PDF as well. where you can get additional information. So the short answer is the ombudsman have not been able to visit either. I want to point that out.
If you're wanting this information, you can't find this information, you can contact our office and we can get this for you.
Yes, absolutely. All right, next one, please. It's a lot of information, so we're happy to provide the information to you. Okay, next one. Okay, we just kind of went through that one.
This is the assisted living document.
Yes, where
The
can
other
I?
one was,
Yes, how about where can I find the current up-to-date information on outbreaks, trends, and information on COVID cases in the state? There is a couple of dashboards. Travis County has it, Williamson County has it. There's also a DSHS COVID-19 dashboard, which provides data, the number of cases per county, fatalities over time by the county. I believe, Pete, and I'm not sure, correct me if I'm wrong, there's a 2-week lag in the information getting reported except for the daily cases. You can find that information generally on the county's website, if that's correct.
yep, that's correct.
Okay. Is there any guidance for ALFs with residents in memory care who are unable to refuse or to wear a face mask? Yes, the CDC did provide some answers on that and guidelines for that, because we understand that residents in memory care may or may not be able to functionally do that. So some guidance was provided on that by the CDC. I did want to make sure I point that out. Next page, please. Another common question we get, can residents leave to go to common medical appointments when necessary? Yes, they can. Do they have to be quarantined when they return? Not necessarily, okay? Let's see, keep going. Anything that I need to cover specifically on this one, Pete?
No, that's good.
Okay, let's move on. Another question that we frequently get, have activities continued for residents? No, activities were stopped during this time period. In other words, group activities, that kind of thing. Okay, and then we should be to the last PDF.
What was the name of the last one, Darla?
It's the COVID frequently asked questions. Maybe it was that one.
That was it. We just went over that one.
Okay. I see that we have quite a few questions. So Jessica, do we hand it back over to you for questions?
So I'm going to take back over. Pete, if you don't mind unsharing your screen for me, please. And before we go to the Q&A, we are going to show a very quick video from one of our sponsors for the conference this year. It is from Mara Group. And it's a wonderful video that tells a story about someone who was in a nursing facility and how they were able to get some assistance, and it really fits in with what we're talking about today. So I'm going to show you that real quick, then we're going to come back and answer all those questions and give you guys a chance to ask more questions that you've thought of during this presentation.
The first day home, there were many things that happened, but I'll tell you this one. I went in and out of this door 4 times just because I could. Carol has more motivation some days than I have ever thought of having.
She sets a goal for herself and she's able to accomplish that.
She's resilient. I got wonderful experiences in my life.
I found my passport.
You did?
You're gonna love the picture.
Oh,
But I was not right in my heart with myself.
well.
I spent all of my life searching for ways to deal with life. Why do I need food so much to feel okay about life?
When we met her, she was in a nursing facility.
I was very big.
Carol had significant health issues, kidney failure, depression.
She was bedbound, she was incontinent, she had heart failure. I had 2 syringes filled with insulin. I had 2 medicine cups filled with pills. I was 547 pounds.
There were days when I would go in there and I didn't know if that was the last time I would see you.
Before I got the help that I needed, I had just decided to give up on life. I was just gonna die.
Some would look at her in a nursing facility and not develop the plans that we did with her and not think that she could be where she's at today. To make it work, we have to understand what support they have and need. And it starts with listening first.
I was so long not heard.
We use our person-centered approach to identify their goals, their desires, and then help put the services and supports in place that will help them achieve that.
She was struggling to find her voice, and person-centered is all about that person's voice.
Here's somebody that comes into my world, listening to me, talking to me about possibilities, just truly caring. And gave me a sense of personhood, a human being, not a case.
She had to have her own motivation. Things like losing weight takes a lot of individual tenacity, but not something somebody can do for you. So we did it with her, but she had to be in the driver's seat. So when we first talked with Carol, we didn't start a lot of plans for her to transition out of the nursing facility because she wasn't ready. So it first started with us talking to her and her mentally preparing.
The first time that I mentioned going home to her, a light came on, but she had a lot of questions. My first reaction was, me go home? No, I don't think so. But then all night long, I thought about it. And then one day I said, I'm ready to make changes in my food.
We need to meet people where they are. And so your goals have to be set where they're realistic and things that you can physically do at that time.
We went from bedbound to jerry chair, from a jerry chair to a wheelchair, until eventually she met me at the front doors sometimes.
Every individual that we can support who then no longer needs our help but can help others, it's why we do what we do.
Isn't that love? I mean, that's love, when you get someone to the point where you no longer need them anymore.
I know it was your job, but you bring yourself to your job and your heart to your job. And so for me, I'll just always love you.
We coordinate with the nursing facilities, we coordinate personal care in the home, whatever it is that will help that individual live independently and successfully.
I was given a certain number of hours a week for home health aides. It helped me to feel like I was contributing to my family, which at that time I couldn't have done by myself. And that is nothing but confidence building.
She progressed enough that, as she says, she graduated from the program. One of our largest goals in providing long-term services and supports is to bring somebody into the community. So it's the meaningful life that we want to help people achieve. The amount that she's paying forward right now is incredible.
Hi, my name is Carol, and I'm calling to see how Miss Jackie is doing today.
It just has opened my eyes to our interdependence as a humanity. I love to smile at people and connect with them. We really, truly are all each other has. Everything tastes sweeter, is sweeter in my life.
All right. That's A lovely, lovely video. And it talks about meeting the person where they are. And that's so much of what Area Agency on Aging does, especially with the Ombudsman's program, is to meet the person where they are with the needs they are and the family needs. Jessica, I'm going to throw it back to you and Pete and Darla. I know that we have got a number of questions, and I'll let you take that away.
We sure do, but I got a message. Miss Darla wanted to add a quick extra note. Go for it, Darla.
A personal shout out to the caregivers, because I have been a caregiver to 3 family members and also a private caregiver. Just because a loved one enters a long-term care setting does not mean you stop being a caregiver. You're just adding partners in care. And there was a statement that was said to me by somebody in the Area Agency on Aging: what do you do to take care of yourself? And I really had to think about that for a moment, because as caregivers, oftentimes we do not. So my simple suggestion on that is make sure that your self-care is intentional. So that means you've got to make yourself do it. Okay, so thank you so much for letting me speak.
Great advice, Darla. If our caregivers don't take care of themselves, there's not going to be that person looking out for our care receivers. So, and that's real important. We have got a pile of questions in the chat box. So Pete and Darla, I'm going to let you guys tag team how you see fit. But I think the number one question that we need to start with is, for those of us that aren't actively involved in this stage of caregiving, can you tell us what the difference is between assisted living, skilled nursing, nursing home, memory care, and do ombudsmen advocate for all of those facilities?
Pete, I'll give it to you for that.
Hold on, hold on. I'm having some issues here with my computer. Can you get? I'm sorry. Could you take that one?
Yes.
Can you hear me? I can't even tell if you can hear me.
Okay.
We can hear you, Pete. We'll let Darla
Okay.
take that one while you turn your camera back on.
Okay, sorry.
So a skilled nursing facility is just an interchangeable term for a nursing home. An assisted living facility is different in a skilled nursing facility based on the level of care that can be provided. So assisted living just implies that there are just some things that that residents need assistance with for living, such as just maybe medication administration or help with meals, that kind of thing. So to me, in my mind, the biggest difference is the level of care that can be provided. Okay, so obviously the level of care is going to be higher that can be provided in a skilled nursing facility, maybe, as opposed to the assisted living facility. Now, keep in mind too that memory care can be located both in a skilled nursing facility and an assisted living facility. Anything else you can add to that, Pete?
Well, I think you need to cover.
It's the level of care, is what it is. Yeah.
And then, do ombudsmen advocate for the residents of all of those types of facilities?
Yes, we do.
Y'all are very busy. Okay. Great questions. Okay. I am going to just mention there are lots of questions in the chat box about the handouts. We are going to email you the handouts following this presentation, and you can always contact the Area Agency on Aging to have us email any information about any of the programs that we're involved in. So by all means, reach out to us for that one as well. A question from a friend of mine, Miss Serena, hi out there. She said, do you think that the staff at the facilities are on their best behavior when the ombudsman walk in the facility?
Okay, Pete, you're up.
Okay. Yes, I do. It's if we're in the facility, or if HHS surveyors, regulatories in the facility, you definitely notice behavior changes, and all of a sudden you see staff hugging residents when normally they don't do that, and it's just you can tell when that's occurring, and you know, I say it's okay. You know, it's all right. It's all right if they're doing it, even if we're around it. At least they're having that interaction, and for that one day, the residents are enjoying that attention. So I say, you know, even though they do it, just because we're there, it's okay. I say it's okay. So.
All right. A question that came in lots of different forms. Darla, you mentioned the phased-in visitation, and I think Pete kind of clarified that a little bit, but there's lots of questions about what does phased-in visitation mean? And so do you want to expand on the answer that you already gave us, Pete?
Sure, there's going to be a phased-in visitation schedule, and HHS is came up with some regulation or coming up with regulation that they put out that the facility has to meet certain criteria before they allow visitation by the family members and the essential care, the caregivers, the ones that are there for a reason, and they have to meet that. They have to. There's certain things that they have to meet. The facility has to go through a vetting process themselves, and it has to be approved by HHS before they are approved to allow visitors. It's just something that they're going to all have to go through. And right now it's voluntary. They all have to apply to do that. And then, like I said, they're not all applying. I mean, some of them are ready for visitors, and some of them are not. And so it's going to be a process, and we're keeping a close eye as ombudsman, because soon we'll be allowed to go back into the facilities, and so we want to make sure that everyone is as safe as possible before that occurs.
Okay. So we have a question. Are the COVID-19 regulations the same for nursing homes and assisted living and memory care, or are there differences?
They're real close to similar. They're close to real similar. They're not. There's because of the type of resident that you have. They're not quite as stringent, I guess, in assisted living. You still have a lot of movement with assisted living. You have a lot of people that are capable of getting up and moving around, and so they have to be really careful because of the level of care is not as needed in an assisted living as in a nursing home. So, but everyone is, it's just one of those. All the facilities are being really careful. They're afraid. I mean, and you can't blame them. They're frightened of COVID. Usually, what happens is once somebody brings it in, then there's a outbreak of COVID among the residents. So they're real careful about that. The regulations are if you'll see in our handouts, they're pretty similar. So some differences, but not too much.
Okay, thanks, Pete. We have a question from Susie, and Susie wants to know, what is the difference between a type A facility and a type B facility?
That's going to be the level of care. The differences between the type B and the type A. The type B is for residents who require staff assistance to evacuate and not capable of following directions in an emergency. And the type A is a type of resident that really doesn't even need to be monitored when they're sleeping. If they were to be well awoken, they could evacuate, follow directions. So basically, it's the level of care.
Okay. Let's see. Can hospice with an outside agency come in to start taking care of a patient in a long-term care facility?
Yes, as long as the facility has a contract with the hospice agency.
Okay, so an outside agency that has a contract with that particular facility.
Yes.
So you couldn't bring in your own private hospice company that isn't already involved with that facility, right?
I haven't seen that actually.
I haven't seen that, so I'm not sure.
Yeah, well, we can clarify that and send that out, but I haven't seen where that in a nursing home where you bring somebody that the facility does not have a contract with.
Now, can a contract be created? Yes, but the facilities get to decide if they want to do that or not.
We have a question in the chat box. I'm not sure this is an ombudsman question. You might want to just refer this to the medical staff or the doctor for your patient. The question is, what are the risks of going outside the facility for doctor's visits and blood tests and eye exams? Does that come under an ombudsman umbrella?
Well, I mean, it's like, I don't know if it comes under an ombudsman umbrella, but it's just like everything else. I mean, every time I go to HEB, I'm running a risk.
Right.
Yeah,
Points
so,
of contact increase with
yeah,
every outing.
right.
That's going to be the answer to that one. Okay.
Sure.
Do we have facilities in our region that have graduated care? Meaning we start at a particular level, and as the person has more needs, they can move along in the facility, stay in the same facility, but get additional care as they need it.
Are you referring to aging in place or?
Yeah, probably. I think that's what she's referring. Yeah. Go ahead, Darla. I'm sorry.
Well, the answer to that is yes, there are certain requirements if it's an assisted living facility that the facility can do so that the resident can age in place. Now, the skilled nursing facility, you know, hopefully they're able to meet the needs as they progress.
I mean, from my experience of teaching classes out in the community, we do have a lot of independent living facilities that have the ability to move into assisted living and then into skilled nursing. Is that more of along the lines of, I think, what that question is asking? So, yeah, you just have to look into each individual facility to see what's available.
And I'll jump in here real quick that is kind of the new thing that is happening in long-term care communities, where you have one campus where you can move in as a couple into independent living, and then let's say that the wife starts developing memory loss and early dementia, that they can she can move into assisted living and the husband can still be there, that they can get the care and move all the way up into full memory care if needed. So those are some of the newer facilities that are opening here in the Central Texas area.
And the only other thing that I would like to add to that is just make sure if you're in that type of situation, moving from assisted living or independent living to assisted living to memory care, make sure you have a clear understanding in the contract of what services can be provided per level of care, if that makes sense.
We have a question for a California resident. How can they get information about the Ombudsman service and the services that might be available in the California area?
Yeah, they can probably just look up their health and human service, their equivalent of the Health and Human Services, and look up long-term care ombudsman on the website and Google it. And there's an ombudsman in every county in the country. So there's the same way that we have a state long-term care ombudsman for Texas. They have the same structure in California as we do here. So that shouldn't be too difficult.
That's a question that I get when I'm out in the community, back in the days when I could go out in the community. So there is an area agency on aging office in every corner of the United States. We have more than 600 offices across the United States, and you can always get in touch with the area agency on aging in your area, and they can get you in touch with who would provide the ombudsman services. Some of them are with area agencies on aging and some of them are not. Another good tool is the elder locator, and that will get you some good information as well. You are always welcome to call our office here in Central Texas. We've got Susie manning that phone line. Susie knows everything about everything aging, and she will get you the resource that you need in California. She'll find a phone number for you, and she's a great detective that way as well. Let's see here. I've got a question, and I'm going to ask the person who asked this question to come back to the chat box and maybe expand. They wanted some information on a patient that might have many medications, and I'm not sure what the question was exactly, so we might need some more information on that one. The next one is, and I think the answer is going to be to this one, it's going to be case by case, guys. Are outside visitations with residents allowed at this time?
Not unless the facility is going through the vetting process, no.
Right now, no.
Okay. All right. Let's see. We got a couple more that have popped up since I've been taking notes. Let's see. Can you graduate from assisted living to memory care? I think we covered that one.
Yes.
Let's see. Somebody's got a lifestyles, newlifestyles.com as a resource. I'm not familiar with that one. Yes, elder care at, I'm sorry, my messages in my chat box are moving as I'm reading them. Patty Bordy, our great director from the Area Agency on Aging, wants to make sure that everybody's got the website for eldercare.acl.gov to get information no matter where you are. Let's see. We've got a clarification, guys. What is memory care?
It's a level of care that's provided to cognitively impaired residents. So some assisted living facilities can be certified memory care and some are not. On that prior question, can I add just one more thing? Moving from assisted living to memory care, they can't just do that. There has to be an assessment type process to assess the level of care and if that is needed. So hopefully that will help clarify that.
Okay. We've got a question as a volunteer who has volunteered at several long-term care facilities in my area. How can I protect myself from COVID-19 when I return to volunteering?
Follow all the precautions. Infection control, you're going to be screened, masks, hand sanitizing. So all of the protocols that the staff are required to follow, I think would be helpful for volunteers as well. Definitely.
I heard Pete mention this, and somebody has a question. Pete, do we have volunteer ombudsman, and how can someone volunteer and become an ombudsman here in Central Texas?
Yay.
Yes, we do have volunteer ombudsman, and you can get information if you'll contact me, and I can get all that to you. I will. If you can call my office. You can send me an email. I will get back with you with all the information, and then I'll start hounding you because I need as many volunteers as I can get. We have a big area, and if I'm not hounding you, Darla's going to be hounding you.
That's right.
We provide all the training. The requirements are be over 18 years old and have a lot of extra time on your hand and be ready to go through a training program. It's 60 to 90 days now, and it's 12 hours classroom time, 36 hours total class training. We put you out in the field. We'll put you in a nursing facility. We'll walk with you through the facility. We'll teach you how to do the job, and you'll be hounded from then on by me or Darla.
That's right.
And you'll be a certified volunteer with the state.
And you'll be training with me. So get ready.
And I think the translation of the word hounded means you will be a valuable volunteer.
That's exactly right. We really need volunteers. And we do appreciate all our volunteers. And
absolutely.
they do a great job. Sure.
Right. And I'm going to do a quick plug here, right? The Area Agency on Aging is always looking for volunteers in the Ombudsman program, in the Health and Wellness program. Help me bring my workshops out there as well. So contact us if you are interested in volunteering in any way. We will find a way to have you help us help the older adults out there in our community. Let's see here. I heard a term that I think might need some definition there. I think it was Darla, in your part of the presentation maybe, you said the money follows the person. What does that mean?
Pete actually mentioned that.
Was that Pete? Sorry.
Yeah, that's a program that allows, that would allow a resident to take the Medicaid money that they have, that they're using inside the facility to get back out into the community, meaning that they can go and if they're capable of leaving the facility, the nursing home, they can go back out in the community, live at home or live in an apartment or wherever they can find. It has to all be vetted. Usually that goes to the managed care organization in the facility. They get assessed to see if that's capable. They're capable of doing that, and once they do that, then they get an okay, and they're able to take that Medicaid money that they're using in a nursing home and take it with them to move back out in the community.
That's correct.
And so it's money follows the person.
Okay, great.
There is a waiting list for that. I will just put that in there as a plug. There is a waiting list for that service. So it's better to get the services started so the assessment could get rolling and the person can get on the waiting list for that service.
And usually one of the biggest obstacles there is when you're moving back out in the community, finding an affordable place to live, especially in our region, Region 5, which is Travis County and surrounding counties, getting very expensive to live out there. So the Medicaid money doesn't go a long way.
We do have a couple of shout outs in the chat box, guys. Lots of people out there saying that the Ombudsman have been a wonderful group of people that they have been very lucky to have helping them with their person. And I can tell you that my own experience, when I've got a friend that needs you guys, you step up and put people at ease and let them know that they've got somebody in the facility that's helping them take care of their person. So lots of shout outs for that. You guys are a great, wonderful resource for all of us out in the community. Did I miss anything?
Yes, a question about Colonial Gardens. Do Ombudsman visit there? Yes, Ombudsman visit every assisted living facility and skilled nursing facility in our 10-county region. So the answer is yes.
And y'all are required to visit them on a regular basis, right? Is there some kind of?
I mean,
there is. We make visits. The requirement, it depends on the size of the facility as to how many times that we make a visit on an annual basis. So we try to get out. We'll get out to every facility, minimum once a quarter.
All right, I think we have got just about everybody. And so we do have a quick question. What town counties are our region? So the Area Agency on Aging, we here at the capital area cover 10 counties, and I have to look at my cheat sheet, guys, because I'm not in my office, I'm at home and I don't have my map to look at. So we cover Bastrop, Blanco, Burnett, Caldwell, Fayette, Hayes, Lee, Llano, Travis, and Williamson. That I got all 10. Okay. So, but if your
I'm glad you had that list.
Yeah, I gotta have the list, right? If your person is not in one of those 10 counties, we can find you the ombudsman that's going to cover your county. So by all means, do not hesitate to call our office. We've got connections all across the state and across the country.
Right.
I think we covered our questions, guys.
Great. Thank you, Jessica. And as you mentioned, the Area Agency on Aging there is one in every area of the United States. It is funded through the Pass Through Money of the Older Americans Act. And so it is tax money that you've already paid. So take advantage of this. And that you can, if you're joining us, like the person from California, you can Google the specific town, just Google the name of the town and Area Agency on Aging, and it'll tell you which one of the multiple ones across the U.S. serves that specific area. You can contact them because they're going to know all of the greatest resources available to you in that region. And, right now is such a difficult time for those of us who do have our family members in a long-term care community, because there is so much that is unknown and things are changing every day. And caregiving is hard enough, but when everything changes day to day on you like it has, it can be very difficult, and trying to keep up with it is just impossible. So that's why this Ombudsman program is so important for you, and you should use it as a resource, because number one, you already paid for it and it's free to you. Number two, these are the folks who are keeping up with everything, and they can help you no matter what the issue is. And that's the one thing we want to bring home to you as we conclude today, is that Area Agency on Aging, Age of Central Texas, AARP, all of these resources are here for you. And it is never, ever, ever wrong or defeatist or in any way saying that you're not doing something right when you say, I need some help. That's why these organizations are here. That's why we exist, solely to provide you with that help, because everybody's journey is different. Everybody's journey changes. And like Jessica said, we're not trained as human beings to know all of this stuff in the caregiving process. And so that's why we exist, is to help you in that journey. No matter where you are, we're going to meet you where you are, and we're going to help you with whatever you need. Darla and Pete, thank you so very much for your expertise and sharing all that great information. Jessica, thank you so much for helping facilitate us through all of this. As we mentioned, we're going to send you everything. It'll probably happen tomorrow, but we're going to send you the handouts. We're going to send you all of those pieces that Darla went through. We're going to send them to you as PDFs. We're going to send you the PDF of the PowerPoint that Pete shared with us. We're going to send you the links to the videos for all of the sessions and all the materials that we have covered over the past 4 days and 8 sessions. It has been a whirlwind, we know, but we want to make sure that you have everything you need to help you in your caregiving journey. We're also going to send you a survey. And this is very important because we want you to tell us what you need in your caregiving journey. Our 20th anniversary of the Striking a Balance Caregiver Conference is coming next year, and we're going to start planning that very soon. And every single session that we have done this year and every session we've done prior has come from those surveys. We want you to tell us as a caregiver, what do you need? What's the information you need? What topics do we need to find experts to share for you? And that's what we're going to do. We're going to put together the conference that you need. So be sure and fill out your survey and send it back to us so we can best prepare for you for next year. Again, remember, we are here anytime you need us. So we hope that we have been able to provide information that can help you in your journey today. We hope that you have a wonderful rest of the day, a fantastic weekend, and we will see you again very, very soon. Thank you, everyone. Have a great day.